Good afternoon, everybody. My name is Soroosh Torabi, and I'm a postdoc scholar at the Department of Mechanical Engineering. Usually for these talks, I tend to walk around this stage, but last weekend I sprained my ankle while I was doing canoeing, and it was like this deep, 2 feet. It was like below beginner, and somehow we managed to flood the canoe, fell into the water, sprained my ankle. So if you saw me limping around the stage, I'm fine. Just hope that it's not super distracting. Well, thank you, Society of Postdoctoral Scholars, for this amazing symposium and the appreciation week. Thank you for appreciating us. And the panel of judges and everybody else who showed up today. I'm pretty sure you have enjoyed the first half of the day, the previous talks, but I really, really want you to enjoy the next 10 minutes. And the reason is, well, because I'm going to be talking about poop water, to be exact, the poop in wastewater. Actually, a funny story, I had a bet with my wife that I'm going to be saying the word poop 3 times in less than 5 seconds on this stage today. Gotcha. But I love what I'm doing, and I'm just want to give you a heads up what you sign up for today. So if you're ready, let's go. Back in early 2020, the first case of COVID was confirmed in the US. Social distancing, wearing face masks, washing hands, it all seemed to be not enough. COVID was killing more people across the country, across the globe. And soon you could see new cases everywhere. It was like we were fighting an invisible threat. And testing, oh gosh, I hated those nasal swabs. It was a logistical nightmare to get everybody tested. And once you found one new case, that whole family, that whole community was already infected. So we did not know how and where this COVID was expanding to. We were behind our game. So flash forward to 2022, majority of people are vaccinated. There are less mask mandates in the public areas. And a lot of people are using those at-home test kits, but they're less likely to report those to the healthcare provider. So the result is, even though the case numbers are going to be low, but a lot of people are still infected out there. The SARS is still out there. So we're still in that crazy limbo. The number one question is COVID still out there? To what extent and where is it? And the second question is, from the past experience, we know that testing every single person is a nightmare. How are we going to be tracking the SARS-CoV-2 or any potential upcoming pandemic? So we think the key to solve that problem lies within the fact that all living things eat. So just a disclaimer, you know what's coming. Everybody eats, so everyone poops. This is actually a children's book, and to teach them not to hold back their poop. And I first saw it at the bookshelf of my 3-year-old niece. I was like, what are we teaching our kids? But a few years later, this was at the heart of the research that we are doing in our lab. And you may wonder, how? So COVID patients shed virus. And you all know that's why we wear masks, right? But this is not the only exit to human body, right? COVID patients shed virus in their stool as well. Well, technically, they poop the virus. So how does it work in the grand scheme of things? How does it work for us? So those patients do their business, flush the toilet, all that poop comes into the poop water at a community level. And then we sample from those manholes, or whether it be a school, a nursing home, or even a wastewater treatment plant. We collect those samples, we bring it into our lab, we do the processing and the analysis on them, and then we would be able to detect and quantify the number of viruses in that sample. And because this sample is collected from a community level, we would be able to look at the trends of the infection in that community. So we are not looking at each individual. We are not testing single people, but we are looking at the trends. So far from the early 2021, when we started this project, we had collected, processed, and analyzed more than 1,400 samples from 19 different locations, including nursing homes here in Lexington and Louisville area, University of Kentucky dorms, and also wastewater treatment plants across the Eastern Kentucky. And here is an example of the results or the data that we produce. You're looking at a very specific location in Eastern Kentucky, and the light blue bars are the exact number of SARS-CoV-2 that we are able to detect in wastewater. And those darker bars are the actual number of COVID patients in that region. You can see that the overall trend matches really well, but I want to point you to that very last peak. This is the current Omicron wave that we are dealing with. And you can see the numbers of the COVID virus that we detect in wastewater is much higher than the clinical cases out there. And guess what? A lot of people are using those at-home test kits. So there is this gap between the data that is out there that maybe WHO is suggesting that we are seeing the end of the pandemic. I really hope we do, but that might not be the case. So we have been working with CDC. So they do have this online live COVID tracker dashboard. And what you're looking at is all those locations across the country from different groups who are contributing to this national monitoring system with the wastewater. So if you zoom into the state of Kentucky, that's us. That's where we are providing all those information or reports to the CDC so they can have more overview of what's going on in terms of COVID in wastewater. So you might wonder, what is next? So what are you going to be doing with this? So the way it's being done right now, all these samples from different locations are shipped to us in a central lab in the College of Engineering, Department of Mechanical Engineering. That's where our lab is. We do that, everything, we are fully equipped. We do all the analysis of simple sample processing in there. But we wanted to enable other communities to be able to use that too. And that is why we wanted to go beyond that. So this is the custom van-based lab that we built with all the necessary equipment that you might need to do this process in the back of that van. And that is actually our lab technician who drives out there a couple of days a week. And he literally sits in the back of the van in the parking lot of that wastewater treatment plant, collect the samples and process the samples. So it gives us a quick turnaround on the sample analysis side of things. But we wanted to go even further. We are getting the samples right now. We have the ability to go to those communities, but what if those areas are remote areas and we cannot get there? So we wanted to go even further. So this is actually a picture of one of the wastewater operators who, with minimal training, a couple of hours of training, was able to do the same analysis that we do, either in the lab or back of the van at his desk in the wastewater treatment plant. So they can do this independent of us in a setting like this. So our big goal that is on the horizon right now is to expand this to even more rural areas, more remote areas across the globe, including Vietnam, Madagascar, and Uganda, so that they could be able to do the same analysis at their convenience with at their low setting facility. And the other approaches that we are doing in our lab is that we are trying to simplify everything. If we can incorporate automation, we're going to process more samples faster. We can get the turnaround and we'll be able to make those calls much faster. We're also developing more methods, how we can better detect those SARS in wastewater. How can we make more educated prediction of the data that we get? Also, with tiny devices like this, we would be able to call different types of virus or organism that we see in the wastewater. So we can call the next variant, I don't know what is after Omicron, but we could do that too. And that opens the door to finding the next emerging diseases that are coming out. Like you have heard about monkeypox, polio. These are something that we can actually look for in wastewater. So with all that, it takes a huge team to do that. So I'm not the only one doing all the work. We have collaborators from different colleges, engineering, communication, health, public health, medicine, communication. I got everyone. And thanks to all of them, we have been able to pull this off. And with that, I just want to let you know that I'm not sponsored by the author of the book. Thanks.